All right. Hi, everyone. My name is Jonathan, and my topic of choice for this course is depression. So, over the next 20 minutes or so, give or take, we will learn about depression. We'll look at what is depression, we'll try to define it, we'll look at what causes depression, since there are many, many factors, reasons why people have depression, what to look for in a student if they may have depression, and what you should do if you suspect your student is having depression. Then we'll be looking at types of treatment that are out there at this moment, and then we'll finally look at what we can all do together as teachers, as educators, as everyday people in order to fight depression and mental health as well. So we shall begin looking at what is depression. Everyone has bad days and low days. It could be for breaking up with your boyfriend or your girlfriend, or you didn't get the grade or marks you wanted in school. It could be a death in a family, many, many reasons as to why you're having a bad day. However, depression is a mental health issue. It is real, it is serious, and it's something that we need to take really seriously. Like I said, students may have sad days from time to time, but they usually get over it. It doesn't affect their everyday daily activities, and it will just eventually go away. People to have bad days, like you and I all have bad days, but we eventually get over it and we move on with our lives. On the other hand, depression is like a sadness that just won't go away. Even on your good days, it's just you're feeling absolutely sad, low, this feeling. So depression, just the sadness that won't go away, and it actually affects how you live your life every single day. Like I said, even on good days, you still feel sad. So just this everyday feeling that won't go away. However, lucky for us, depression is treatable, and we'll talk more about that later on. So right now on my screen, you'll see a little chart that I found online. It does an excellent job in terms of identifying the misconception of depression. Most of us, when we think of depression, we think of sadness. Well, people with depression, they actually feel more than that. Okay, so it's not just about sadness. Again, like I said, we all feel sad and low at all point here and there, but with depression, someone who has depression, they feel so much more emotion. It could be hopelessness, they could feel isolation, anxiety, guilt. Again, so much emotion come into play. They basically don't want to do anything. I spend most of the time just, for example, lying in bed, try to gather the energy to do things. Again, this is not the exact representation of what people with depression may go through, but again, it does illustrate what they feel. And a misconception about depression is not just about sadness, it is an actual mental health issue, it is a disorder, and it's something that is absolutely really serious. People with depression, well, they could feel many, many things. Well, I have some quotes on my screen that I have gathered. For example, feeling you are not a person anymore, feeling like you're never okay, actually wanting to break down because it's something you are good at, not wanting to go to sleep because then you will have to wake up in the morning and start all over again. So, again, these are just some thoughts that what people with depression may go through. Again, there are tons of quotes out there dealing with depression. Just Google it and you'll see tons. With depression, it can be linked and associated with anxiety. When I did some research, I noticed that anxiety came up a lot. But for this presentation specifically, my goal is to focus on depression. On my screen, you'll see a little Venn diagram chart. that has the comparison between depression and anxiety and what they can feel like in terms of both. Again, it could be restlessness, worrying, again, so much other feelings as well, as you can see. But again, our main focus is to look at depression. Depression. There are some difference with anxiety, but again, we're focusing on just depression. Alright, moving along, I got some numbers. So by the numbers, I got some stats to share with the class and our colleagues. Depression is actually pretty common, believe it or not. It is actually less common in youth, in children, and in teens. It is more common in adults, but again, it can occur in children and youth as well. About 1 in 5 will have depression or will experience depression before they turn 18. So 1 in 5 will experience depression by the time they turn 18. Girls and women are more likely to have depression compared to men, about double that number. So again, that could be a factor as well when looking at gender. Here in Canada, about 3 million Canadians have depression. However, only about 1/3 actually seek help. So again, it's not a huge number, but again, it's a big enough number that we should be concerned about. So again, just some numbers, some facts to throw out there in terms of looking at depression. Next, types of depression. There are actually more than one type of depression. I'm going to share with our class and our colleagues 3 of them. So the first one is called clinical depression. It's probably the one we most hear about or know about. Clinical depression is the most common one. It starts to affect the ability to succeed in daily life or how we feel life is not worth living. It starts to happen almost every day, and it happens for more than 2 weeks. Okay, so this is kind of like a little hint and alarm bells for us teachers, as if we see something different in our students about their behavior, the way they act in terms of that not enjoying their activities, and if this is happening for more than about 2 weeks, this is a good indication that it could be clinical depression. Persistent depression is pretty much the same thing, but it just happens for a longer extended period of time. It takes place for at least 2 years or more, but it's pretty much the same thing. And lastly, seasonal depression. It associates with the amount of sunlight that we get every day. So especially in the fall season and in winter months. Again, whether or not the weather can be a factor, it could. So it could be a cloudy, dark, gray day. Again, that could impact our mood as well. Whereas on the other hand, if it's warm and sunny, it may actually cheer us up, make us feel better. I think we can all relate to that as well. So again, seasonal depression is a factor as well. But again, just to go back in terms of what depression is, it starts to impact our ability to do what we enjoy, our activities every day, how we make decisions. Again, these are all hints and alarm bells to look out for in terms of depression. So what causes depression? Now we know what depression is, the different types of depression, but what actually causes depression? Well, the true cause or causes of depression has yet to be pinned down precisely, since there are so many factors, variables that come into play. We know that depression is a mental health issue, disorder. It is a disease with a biological base, along with a psychological and social implication as well. Sometimes people just feel depressed for absolutely no reason. And again, it's something that we should not just say get over it. Again, like I said, it's a mental health issue. It is serious, and we just shouldn't just say get over it. In terms of relating that back into school and in the classroom, other factors can come into play as well, such as not doing well in school, like I said, not getting the grade that you want, stress, conflict with your friends, feeling like an outcast, bullying could lead to depression. It could be conflict at home with family members. Again, that can translate into how a student feels and function at school as well. So again, there's many factors that come into play that leads to depression. But again, all these factors come into play. Other factors, other reasons could be a biological factor, such as too much certain brain chemicals going on. It could be a cognitive factor. Well, people or students just think negatively. Again, because of that negative thinking pattern, could lead to a low self-esteem and how they function every day. So again, think positive. That will help as well. Gender. Again, we talked about gender, how girls and women are more likely compared to men to have depression. Again, gender is a factor as well. Medication. Some side effects. Again, some students may take medication, and because of that, it could lead to some side effects that leads to depression. Who knows? And lastly, genetics. Again, it could be family history of depression, a combination of genes, environmental factors, all that can come into play as well. So what I want to try to emphasize is that depression, there are many factors that leads to depression. It's not just one. Checklist. Does your child or does your student have depression? How do we know? What can we look for? So on my screen right now, as we move on to this slide, there are many signs and possibilities that leads to depression, such as feelings. Does your child or student feel or express sadness, hopelessness, guilt, worthlessness, not enjoying everyday pleasure? Thinking. Is your child or student having difficulty with concentrating, making decisions, completing schoolwork, or maintaining the grades? Or it could be physical. Does your child or student complain about headaches, lack of energy, sleeping problems, weight gain, or losses? Or it could be behavioral problems. Is your child restlessness, not wanting to go to school, want to be alone, not getting along with others, skipping school, drinking, using drugs? Or are they having suicidal risks? Does your child think or talk about suicide or death? So again, these are all checklists, alarm bells to look for. Should we hit the panic button? Again, is your student acting differently for at least about 2 weeks, give or so? Why are they acting that way? Why are they changing? Do they complain about these reasons? If so, it could be depression. So again, keep that in mind. There's many clues and hints to look for when we're dealing with depression. But as teachers and educators, or as parents even, if you suspect your child or student is having depression, what should you do? Well, one, see a doctor. Okay, see a doctor. See your family doctor. Again, it could be, who knows, could be medical problems or medication that be causing or contributing to depression. They should know about their history of medication and health, so they should know. But see a doctor. okay, a family doctor. At that point, your doctor may recommend seeing a specialist, psychologist, psychiatrist, a social worker, and it branches off from there. But first, it is recommended that they see a doctor, family doctor, and then at that point they will decide, make recommendation, like I said, see a specialist in the health service industry, psychologist, psychiatrist, and move on from there. So again, talk to your doctors about it. In terms of treatment, I already mentioned that depression is very treatable. Most people overcome it or do show signs of improvement, which is awesome, which is great to hear. But in terms of treatment, it could comes in many different forms. It could be therapy, where you work on changing your thoughts, behavior, not thinking negatively anymore, but thinking positive thoughts, and help to improve relationships. It could be medication. Again, depending on the circumstance, medication can help ease depression, or it could be counseling as well. But again, the choice depends on the pattern, severity, what it's like. Again, doctors, psychiatrists, and so forth will depend or recommend the type of treatment. It just depends on that certain case. But again, there are many different forms of treatment, and depression is very treatable, and most do overcome it, which is awesome. So as teachers, again, what can we do to help? Or what can everyday people do to help? Some suggestions, some strategies as to what we can do to help cope with a student or someone who is dealing with depression. So one, it could be let your child or student know that you notice there is something wrong. We are here to help them. It could be, I'm noticing that you seem a bit different these days. You seem a bit stressed out these days. You don't seem yourself these days. Also, we should express our concerns and say, for example, hey, I'm worried about you. I'm scared that you might be doing something wrong or there's something wrong. Offer support. Is there anything I can help you with? How can I support you? Or give them choice, okay? I know we all love choice. Students love choice as well. So give them a choice. For example, we can say, we really need to talk about this. Do you want to talk about it now, or do you want to talk about it later? And lastly, have fun, relax, have fun, relaxing time with your child or with your student. Again, just all about, hey, we need to have more fun together. I have some ideas myself, but what things would you like to do? So again, these are just some suggestions as to how we can help anyone with depression or has some signs or symptoms about depression. Again, more tips to fight negative feeling, and with mental health, it could be related to depression as well, but it could be ensuring your students get enough sleep, make sure to eat healthy meals and snacks. Again, eat your greens, fruits, and vegetables. Lots of physical activities, get some sunlight, use some natural light in the classroom. Make it fun, laugh. Again, it goes a long way. Ensuring everyone stays away from drugs and alcohol. Relax and be social. Again, these are all types you can do and deal with to help combat mental health issues and depression. Again, other tips that we can do is simply just shed the light on it, talk about it. Again, today is January the 25th, 2017, and it's actually Bell Let's Talk Day. So again, if you have been on social media today, throughout the day, you have noticed people have been using the hashtag Let's Talk or Bell Let's Talk. Again, this is today's day where Bell donates 5 cents for any hashtag to spread awareness dealing with mental health. Depression falls under this category. It is a mental health issue. It is a mental health disorder. But again, there are so many things that we can do to end the stigma. Simply, the language matters. Pay attention to the words you use about mental illness. Educate yourself. Learn about it. Learn about depression. Learn about mental health issues. Okay, learn so that we know and talk more about it. Understand the signs and symptoms of what depression could be. Be kind. Simple acts of kindness or random act of kindness goes a long way, and it does a lot. We can listen and ask questions. Sometimes the best thing to do is simply just listen, as you're doing right now. Talk about it, start a dialogue, break the silence, just talk about it, spread the word. It will go a long way. So again, there's so much we can do to help anyone with mental health issues or anyone battling with depression. Again, be patient, don't blame, encourage everyone to seek help. Something that we should avoid is simply don't point the finger, don't blame. Okay, don't blame the student that it's their fault that they're having depression. No, don't do that. It just makes things whole whack worse. Again, don't blame, avoid making opinions. Again, it just makes them feel absolutely worse. Again, don't expect anyone or student or child with depression to simply just snap out of it. It just doesn't work like that. Like I said, depression is a mental health issue, disorder. It's like saying someone with asthma or diabetes or other medical condition to just get out of it or snap out of it, get over it. It just doesn't work like that. Depression is the same thing. So again, we need to consider, be respectful, and do as much as we can to help, but not blame or tell them to get over it. So in conclusion, here in Canada, as we know, mental health services may be organized differently depending on which province or territory we live in. But with that being said, there are things that we can do together to combat and fight depression. For example, like I mentioned, if you suspect someone that has depression, whether it's a child, a student, or a friend, see a doctor, okay? See your family doctor. Hopefully they will make recommendations and get the help that they need. Kids Help Phone Line, again, if they don't want to talk to us, talk to the teachers, again, they can call the Kids Help Phone Line as well. Check out their website, call them, all of that as well. Before we wrap things up, on my last slide, it's some videos. On the top left, it's a video about the signs of depression. So if anyone wants to know about the signs of depression, about what goes on in the head, in your brain, about your genes, you can click on this short video that tells you about the signs of depression. On the bottom left video, again, it's a little TED Talk video that deals and talks about what is depression. Again, it talks about what goes on in the brain and how it all different chemicals may be linked and all these other factors, but it talks more about what is depression. And finally, on the right-hand side is Bell's Let's Talk. It's this year's playlist. Again, some of it you may have already seen on TV commercials and other videos that could be posted on social media. But again, it could be Clara Hughes talking about her struggles, Michael Landsberg from TSN, Howie Mandel from TV, that TV show of Deal or No Deal. So again, a lot of famous celebrity talking about how we should end the stigma about mental health. So I think I'm going to stop it right there about this presentation. I hope you have enjoyed it. Hope you have learned something about depression. Again, if you have any questions or comments, make sure you comment below in the comment section of our discussion. I will get back to you, answer any question you may have. But again, thank you so much for taking the time and watching and listening. Again, I hope everyone have learned a little bit about something or something more about depression that you may not have known before. So again, any question, just comment below and I'll get back to you. Thank you so much and enjoy the rest of your day. Thank you.